Hello. In continuation with anxiety disorders, we have done with phobic panic disorder, GAD. We have also discussed about obsessive compulsive disorder, and now we are going to discuss about body dysmorphic disorder, the dissatisfaction of bodily appearance, which is perceived dissatisfaction. And we are also going to discuss about PTSD, post traumatic stress disorder. So what exactly means? Body dysmorphic. Earlier, all these disorders were separated, but in DSM-5, body dysmorphic, hoarding, trichotillomania, skin picking, and other disorders, they have listed under OCD only. So main point, a preoccupation with one or more important word is perceived defects or flaws in physical appearance that are not observable or appear slight to others. At some point, these two important aspects are there during the course of the disorder, that repetitive behavior and mental acts. Repetitive behavior means what? Constant mirror checking, excessive grooming, skin picking, reassurance seeking, everything. And even mental acts. That means comparing our appearance with others in response to the appearance concern. So they may have strong perception or strong feeling that, example can be नाक थोडं मोठं आहे, मग ते जाड आहे, मग ते नाकाचं हाडच वाढलेलं आहे, किंवा खूप पिंपल्स आहेत आणि मग ते असंच दिसतं, ते अगलीच दिसेल, मग मी ॲप्रोप्रिएट आहे का नाही आहे, हाऊ अदर्स आर गोइंग टू परसीव मी अँड ऑल. So anxiety, stress, tension, everything goes hand in hand. So they are more cautious about their appearance. The preoccupation, it causes clinically significant distress or impairment in social, occupational, and even other areas. Again, remembering the important criteria of abnormality is inappropriate perception of the reality. So in real, their appearance, it is absolutely normal, but they perceive some defects or flaws in their physical appearance. To be specific in detail, these people or patients with body dysmorphic disorder, BDD, they worry that there is something wrong with the shape, appearance of a body part. It can be about breast, genital, hair, or nose, or even something like that. They frequently request medical procedures or plastic surgery to correct their imagined defects. Patients are often dissatisfied with the results. A young girl around 10-12 years back from Nasik only, at that time she went to Singapore thrice in a year, and 3 times in a year she conducted plastic surgery because she had a strong belief that her physical appearance, especially facial appearance, it is not appropriate or up to mark. So at that time, around 10-12 years back, she spent around 4 lakh rupees. The behavior which caused clinically significant distress to self and others to such an extent that she spent 4 lakhs, that too 10 years back. So they seek reassurance, try to hide their perceived deformities, not real but perceived, either with clothing, body hair, avoid social situations also. Compulsive checking, it is like a hallmark of these people, and isolation at times. So their perceived abnormalities, their inappropriate perception of the situation, inappropriate perception of their appearance, gradually it turns into isolation. in some kind of stress, tension, avoidance, escapism of social interactions. And that's why mood disorder, depression, anxiety and OCD or even BDD, it goes hand in hand. Interesting studies conducted by Phillips in 2005, he found that the ratio regarding physical or bodily parts, it differs. Means, for example, around 73 people, 73% of people, they are dissatisfied about their skin. 56% of people, they are dissatisfied about hair. 20% about eyes, and so on. Important thing is, it is not ordinary concern. They are far more extreme, which leads in many cases to complete preoccupation and significant emotional pain. Now, what exactly leads to have or to suffer BDD? First thing is emotional sensitivity to appearance, the comorbidity with other psychological disorders, too much sensitive to social pressure or so-called as social criteria of acceptance, like in teenage. So some have very strong attachment, affection about their appearance. So all these things, it leads or it may term as causes for having BDD, body dysmorphic disorder. Now turning to the fourth aspect of anxiety disorder is PTSD, post-traumatic stress disorder. Umbrella term is primary trauma and stress related disorder. In that again we have 4 subtypes, but out of these 4, currently we are going to discuss or focus only on PTSD and acute stress. However, other 3 are reactive attachment stress disorder, disinhibited social engagement disorder, and adjustment disorder. Earlier it was named as conduct disorder. In DSM-4 and 4TR it was called as conduct disorder, but now it is adjustment. So now let's see about PTSD and acute stress. First, PTSD, post-traumatic. The name itself speaks a lot. Post-traumatic. After that particular traumatic event, the way the person or that particular individual feels, suffer, experiences the stress is called as post-traumatic. It is applicable or it can be termed for 6 years and above. First criteria according to DSM, exposure to actual or threatened death, serious injury, or even sexual violence in one or more of the following ways. Remember, multiple personality disorder or dissociative identity disorder, 70 to 80% earlier sexual harassment is the one of the important cause which leads to multiple personality disorder. So the first thing here is direct experience the traumatic event. Many of you may have seen such kind of scenes in movie or so, but imagine if the person is actually witnessing some injury, some accident, some traumatic event, some death or so, or may have the experience some kind of sexual violence. What kind of psychological impact at that particular time he or she may have. So witnessing in person the event or events occurred to others, either with self or with others. Learning that the traumatic event or events occurred to a close family member or even close friend. In case of actual or threatened death of a family member or friend, it must have been violent or accidental, because that creates stress. So grief, it is different, and stress, it is different. Experiencing repeated or extreme exposure to aversive details of the traumatic events, and therefore B criteria, presence of one of the following, like recurrent, involuntary and intrusive. So repetition, it should be there or it occurs. Intrusive, distressing memories of the traumatic events. Recurrent, distressing dreams in which the content or effect of the dream are related to the traumatic events. Dissociative reactions like flashback. All of a sudden the person goes into that particular memory lapse. फक्त आणि फक्त तेच आठवतं की एकदम अचानक तो कसा ॲक्सिडेंट झाला, आपल्या समोर त्या एक्सवायझेड पर्सनची डेथ ही कशी झाली, इंजुरी ही कशी झाली, लाईकवाईज. किंवा मग जसं मूवीजमध्ये दाखवतात की एखाद्याने तो तसा मर्डर बघितला आणि मग नंतर त्याला सारखे तेच स्ट्रेसफुल अटॅक्स येतात. सो इट इज द सेम थिंग. In children, traumatic specific reenactment, it may occur in play also. So at the time of playing, the way they react, it should be observed. Fourth aspect under B criteria only, intense or prolonged psychological distress at exposure to internal or external cues that symbolize, because images are symbolic in nature or resemble an aspect of the traumatic events, mark physiological reactions, escapism, avoidance, temper tantrums, or something like that, or external cues that symbolize or resemble an aspect of the traumatic events. And C, persistent avoidance of stimuli associated with that traumatic event. So learning principles are so much applicable in most of the psychological disorders, especially anxiety, because it works like a cue. So classical conditioning application, here we can easily see avoidance of or efforts to avoid it, distressing memories, thoughts, feelings about or closely associated with traumatic events. Avoidance to external reminders, ज्या गोष्टींमुळे त्या स्पेसिफिक एका इन्सिडेंटची आठवण होते त्या गोष्टी पण अवॉइड करणं. मग ते ऑब्जेक्ट असेल, सिच्युएशन असेल, एखाद्या व्यक्तीला बघितल्यावरती परत तेच आठवतं किंवा समथिंग लाईक दॅट. Arouse distressing memories, thoughts, feelings about or closely associated again with that traumatic event. D criteria. So we have discussed A criteria, B, C and now D. Negative alterations in cognitions and even mood. So thinking and feeling goes hand in hand with even actions, that too in a negative way, associated with the traumatic events. Inability to remember an important aspect of the traumatic events. Persistent and exaggerated negative beliefs or expectations about oneself, others or the world. Cognitions about the cause or consequences. Persistent negative emotional state like anger, aggression, avoidance, escapism. It may be like anything. Diminished interest or participation which can easily observe by others. Feeling of detachment or estrangement from others, and persistent continuous inability to experience positive emotions. So those who survive severely traumatic events, it has been found that in some research, in some studies, it has been found that they more tend to develop PTSD. Survivors of combat are the most frequent victims. Other situations may include rape, floods, airplane crash, as well as the threats that may be posed by kidnapping or hostage situation. So imagine जर एखाद्याने हे ॲक्सिडेंट्स किंवा किडनॅपिंग वगैरे सगळं बघितलंय किंवा त्याच्यासोबत जर तसं झालेलं असेल तर त्याला हे सगळे सिम्पटम्स किंवा अशा सगळ्या गोष्टी एक्सपिरियन्स होण्याचे चान्सेस तिथे जास्त असतात, बिकॉज सम ऑर द अदर वे that particular individual he has been a part of that traumatic event or stressful event. Children can have PTSD as a result of inappropriate sexual experience. It can be diagnosed even in those who have only learned about severe trauma suffered by someone to whom they are close. Children, spouses, other close relatives, like this. After some delay, the person in some way relieves the traumatic event and tries to avoid thinking about it. Around 4 to 5 years back, Shakti Mill gang rape case, it was there. Many of you might have heard about it. 2-3 people, they rape a lady reporter. After an hour or so, somehow she managed to go to police station and she reported that certain thing has been happened with her, and so she was intended to launch a complaint. Hardly within a week, Mumbai police arrested those specific 4 guys who raped her, and after a couple of months or so, when actual court trial was started, in the court, the moment that lady reporter again witnessed or saw those 4 guys, she immediately fainted right there. She was unconscious for a day, but after that somehow she managed, and then she again gave the statement against those 4 guys, and then further it move on. So that spontaneous reaction of fainting or एकदम त्या चौघांना त्या पर्टिक्युलर स्पेसिफिक इन्सिडेंट्स नंतर इव्हन 2 महिन्यांनी जरी बघितलं तरी ते बघितल्यानंतर एकदम विदिन अ फ्रॅक्शन ऑफ सेकंड ते सगळं परत आठवणं आणि एकदम अनकॉन्शियस होणं 1-2 तासासाठी. So this is what is the reaction under PTSD, post-traumatic stress disorder. So symptoms like physiological hyperarousal, exaggerated startled response, negative feelings, the more horrific or more enduring trauma, and everything like that. The comorbidities: mood disorder, anxiety, and substance use disorder. Similar aspect, but a different term is acute stress disorder. So in psychopathology abnormality, chronic and acute, I will insist that you must search these 2 terms on internet and even in reference book also. So acute means what and chronic means what. Acute stress disorder means a shell shock. The number and the distribution of symptoms is different, and the criteria embody the same elements required for PTSD. Only the degree as compared to PTSD, here it is slightly different. Exposure to an event that threatens body integrity, re-experiencing the event, distress or impairment, increased arousal and reactivity regarding that particular stressful traumatic event, negative changes in mood and thought, and avoidance of stimuli associated with that event. All these symptoms usually begin as soon as the patient is exposed to the event, but they must be experienced further out than 3 days after the stressful event, because if it is just for a couple of hours or so, it can be natural, temporary पण असू शकतं. So this gets us to a period of time beyond the stressful event itself and its immediate aftermath. So APA and DSM quite specific about it. So they said symptoms should last longer than 1 month. The duration, it is most important in diagnosing. See, diagnosing the appropriate psychological disorder, it is most important part. They are no longer acute and no longer constitute acute stress disorder. ASD, it stands for acute stress. And lastly, to discuss something truly awful has happened according to them, that grave injury or sexual abuse, traumatic death, injury of someone else or so, and at least 1 month. So 1 AM means 1 month. The patient experiences intrusive memories or bad dreams, associated experiences like flashback, as we have discussed again with PTSD, inability to experience joy, similar to mood disorder, amnesia for parts of the event. So for them it was so traumatic, so stressful की तो पर्टिक्युलर आस्पेक्ट ते जे अर्धा तास काय झालं ते एकदम विसरूनच गेले. 1 महिन्यापूर्वी काय झालं होतं, they have totally forgotten. Attempts to avoid reminders of the event, escapism is there. And hyperarousal symptoms like irritability, hypervigilance, sharp eye, constant observation, focus on the specific factors, trouble concentrating, insomnia, and so on. So likewise we have discussed with OCD, body dysmorphic disorder, PTSD, acute stress, and earlier we have discussed with phobia, panic, and generalized anxiety disorder, specific phobia, and social phobia. Yes. Thank you.